Okay, so before I walk to the patient room, I'm going to review the patient records. Okay, the patient has order for IV saline because the patient is dehydrated. Okay, so then I go on the patient room, knock. Hello, my name is Tashana. I'm going to be your nurse and I'm going to be administering you saline because you're dehydrated. What's your name and date of birth? I check. I wash my hands. I don gloves. I provide privacy. And your name and date of birth? I checked it. Okay, that matches up. Okay, Mr. Jones, what is your pain level? Okay. 10 out of 10, okay. So I'm don gloves. So I go to the drawer and I make sure I check. I go and I get the medication, the saline, and I make sure it looks clear, there's nothing wrong, the date is okay, and then I go back, I check the patient's GI. First I inspect, I auscultate, I percuss, and then I palpate, lightly palpate, and then I do the vital signs, and I check the lungs, the creatinine level. Okay, so I checked it at the record, so then now I scan, so that's my third time, and the patient match. So now elevate the bed at hip level. Okay, so then I take off the cap, and I hold this upside down because I'm twerking the bag, and then I'm going to take the cap off. Then I push it all the way in. Okay. And since I don't have a machine, I would push in here. Okay. Okay, I see it drip. And I will hang it. Squeeze the brag, I'm priming it. I'm going to uncap the end. I'm going to unclap it to make sure there's no infiltration. Okay, everything is fine. Now I'm going to reclamp the line. Okay, I'm going to load the tubing to the pump and set the rating at 20 mL per hour. I'm going to turn to the patient. I'm going to check the patient IV site for infiltration, occlusions, pain. Are you in pain, Mr. Jones? Okay, there's no swelling. Okay. I'm going to wipe it with an alcohol swab. Let it dry. Okay, I'm going to insert saline slowly. Okay, now I'm going to recheck the IV site for any conclusions. Now I'm going to go with alcohol swab, clean it. Now I'm going to infuse the saline. And I'm checking for venous infiltration. Everything's fine, it's normal. Mr. Jones, do you feel any pain? Okay. I'm going to label the bag and make sure the time, the date, my initials. And then I'm going to document the drug, the time, the date. There was no infiltrations, there were no pain, there was no It was 5 mLs and the duration I set the tubing for. And I'm going to document how the patient felt during the procedure. And that's it. Thank you. Also, I'm going to take off my gloves, wash my hands, and put the patient back in a comfortable position.